Do you want to welcome them via chat, Elsie?
Well,
recording in progress.
This is Jeff Jagir. Thanks for joining. We'll get started in a couple minutes.
Tilt it down just a tad.
What's that?
There's too much.
Tilt it
Too much of that.
So welcome to this month's edition of the Cancer Prevention and Wellness Talk. I'm your host, Jeff Jagir, and tonight we're going to talk about an ever-burgeoning topic of gut health via the gut microbiome and how that can affect your health and how you can affect it to improve your health. Before I introduce our speaker tonight, just a couple of housekeeping issues. First of all, if you're on the call, we appreciate it, and you will be muted. But certainly we welcome any kind of questions you have, and you please enter those via the chat box, which we will be continuing to monitor throughout this. I want to let you know that this will be recorded and will be available via the website. That's cancersurvivorspark.org, all one, not separate words, cancersurvivorspark.org. As always, this is sponsored by the Cancer Survivors Park Alliance. And so I want to make sure that everybody knows that it's being recorded, and if you enjoy the comments and feel that they're worthwhile, that you share that with people that you know. So tonight we are very pleased to have with us Dr. Andre Eaddy. Dr. Eaddy is a gastroenterologist at Pubmed Health. He's also an assistant professor at the USC School of Medicine, Greenville. He grew up in the Columbia area. He went to Morehouse College for his undergraduate, and in the summers did some basic science research at some institutions noteworthy as Northwestern and Emory and Duke. Became interested in oxidative stress, and specifically oxidative stress in cancer. Ended up going to the Medical University of South Carolina for his MD and PhD. So he's a medical doctor, but also a PhD in science. From there, he went to internal medicine residency at Vanderbilt, where we had some reminiscence together, and then stayed at Vanderbilt, stayed in Nashville for his gastroenterology fellowship. So while he was in Nashville, he did some work on microbiome at their lab there, so has expertise. So it's just wonderful to have Dr. Eaddy as well as his expertise to share with us in a subject that has really kind of blossomed in the last 5 to 10 years and has helped us kind of to describe things that we can do to affect our health via the gut microbiome. So Andre, Dr. Eaddy, thanks so much for being with us, and I will let you take it over.
Thank you, Dr. Jaguar, and thank you for having me. It's such a pleasure to be here, and thanks for giving me this opportunity to talk about this very important and, as you mentioned, kind of growing topic. And so I'll talk a little bit about that and what I know, and I encourage any questions or feedback, and this can be very much a discussion. So we'll get started here just talking about the microbiome and what that means. So what is the microbiome? And so when we think about this, think about your environment and all the bacteria, viruses, and things that live in it. Well, what we now know is that many of that bacteria colonizes our body. So from the time of birth, we begin being colonized, or basically bacteria living in unison with us. And so when you're living in unison, it's thought of more of as a microbiome. When things go wrong, we may describe them more as pathogens, but it's important to think about. So we'll talk specifically today about the gut microbiome. So of all the bacteria that make up our respiratory tract and our bladders, your general tract, our stomach, all of that stuff, well, the GI tract itself, so that's small intestine, stomach, mouth, colon, makes up about 70% of that bacteria. And to put things in perspective, a lot of times, I think all of us, we think of, well, let's think about germs, let's think about washing our hands. And so we know the size of our skin, those sorts of things. So we wash our hands, we wash our bodies, all of that's thinking about bacteria and the things that we interact from day to day. Well, what I want to do to put things in perspective is to think about the GI tract. So we know the amount of skin we have. When you think about the GI tract, and if you were just going to spread out the surface area of the GI tract, that would be about the size of a tennis court. And so you can imagine this bacteria living amongst the tennis court within your body. And so to put that number in perspective, the amount of bacteria that lives with us from day to day, that's about 10 times the number of cells in our body. So an incredible number. And that number starts from the time that you were born. And so there are many things that influence the bacterial makeup called the microbiome. One of the things that we know well is the difference between someone being birthed vaginally versus cesarean section. That alone will change the composition of your microbiome. It's interesting, from day one, you begin building the building blocks of your microbiome as an adult. What's really interesting too is by 1 year old, your bacterial makeup is already kind of resembling what it's going to be as you are an adult and a young adult. Okay, so that's very interesting as well. What you're exposed to in those first years, from your dietary habits, your environmental factors, the water you're drinking, those sorts of things, all of that influence. And then obviously the people you come in contact with. So that's very interesting about the microbiome. And then another interesting point is that as we age, our microbiome, or our bacterial makeup, changes over time. And we think some of those changes will greatly influence things like aging or even cancer. And we'll talk about that today. But let's talk about some of the things that we can do that influences our microbiome. So what are things that influence our makeup? So things like antibiotics. There are antibiotics that are used usually for things that are hurting our body that our body's having difficulty fighting on its own. So in that way, antibiotics are very good, but as any medication, there could be side effects. Often one of the side effects of an antibiotic may be taking out certain members of the microbiome. So antibiotics can cause trouble. Things like certain medicines, particularly what's called NSAIDs or non-steroidal anti-inflammatory drugs. So things like Motrin and ibuprofen, things like that. Tylenol generally does not fall in that field, but I like my patients to keep in mind that medications like that used on a regular basis can actually damage the intestinal tract and change the microbiome. Okay. As I mentioned before, as you'll see in the diagram, vaginal delivery versus birthing can have an effect on your microbiome. The things that we eat, the type of food, so that's very important. So if we're eating foods high in sugar, high in fat, well, as Dr. Jaguar mentioned, one of my specialties was the role of oxidative stress. Well, we now know that sugars and fats directly contribute to the oxidative stress in our bodies when they're taken in excess. And so now you have oxidative stress. And I think of these like little lasers. Think about if you stayed out in the sun too long, that sunburn, that's oxidative stress. And so imagine that's happening in your body. So not only can that have a negative effect on your own cells, but it can have a negative effect on those bacteria. So depending on what foods you're taking in your body, that can create that oxidative stress that might change your microbiome. And in the same way, healthy foods that we eat, things that are considered antioxidants, well, now that's going to be protective of your cells moving forward. It's going to be protective of that good bacteria and therefore influencing a healthy microbiome. There are other things considered in Western countries. So those things, for instance, it's just time. So what we use for animal products and growing, what we used on our vegetables in terms of antibiotics or growth hormones, well, we also think that that is also influencing our microbiome. And so what's interesting when we look at more developed countries like the US, we see a greater proportion of certain type of disease processes, things like immune diseases. Like one of my specialties is also inflammatory bowel disease. Well, we see more inflammatory bowel disease in America than you may see in other places. Things like type 1 and type 2 diabetes. All of those things we think are greatly influenced by the microbiome. Allergies, simple things, peanut allergies, and the proportion of that we see, or allergies to gluten, specifically things like celiac disease. All of these autoimmune components seem to be influenced greatly by the microbiome. And it's been shown that when individuals have the genetics and may even be born in America, but if they're taken earlier to other places with more diverse microbiomes, they may be less likely to develop things like type 1 diabetes, celiac disease, inflammatory bowel disease. And so that's anecdotal evidence to us that our exposures and what we put in our body, that matters. And then more of what we'll talk about today is how things like the microbiome and the oxidative stress related to that, our lifestyle, our diet, how that influences things like colorectal cancer or stomach cancer. And so we'll talk a little bit about that. So that's the importance of the microbiome. I hope that gives a good introduction to what that microbiome is. And
So, Dr. Eaddy, the indiscriminate use of antibiotics, you said that we use them in developing our animal products and whatnot. I know, and probably back in your internal medicine days, you remember people coming to your clinic bound to determine that they have an infection, which was more than likely viral, that they wanted an antibiotic. And I had more disagreements with my patients over the fact I wasn't going to give that to them than anything else. But there's now what I would tell them is I just don't want to create resistant organisms. But now I think there's more of a inclination to say that we don't want to decrease the diversity of your microbiome.
That's exactly right, Dr. Jaguar. And so that we are learning more and more each day about the negative consequences of kind of using antibiotics indiscriminately. So we know that when you're sick and your body's having trouble dealing with something, it's absolutely appropriate to use an antibiotic prescribed by a doctor. But I think what happens so often is someone may start taking an antibiotic and feel a little bit better. Well, then they stop taking the antibiotic and don't complete its course. Well, what's often not realized is that thing, whatever that bacteria is that you may be treating, you may reduce it enough that you're no longer symptomatic, having symptoms, but you may not be reducing it enough that your body's able to fight it completely off. And so now you may be carrying this almost offensive bacteria moving forward. The other thing is treating conditions that don't require antibiotics. So if you get a common cold, although you're coughing, you may be sneezing, you may have a fever, you don't necessarily need, just like that, Dr. Jaguar, you don't need an antibiotic.
I'm here
Okay.
for you.
But you don't go to your cabinet, or you don't have to call your doctor and say, hey, doc, I need a Z-Pack. Well, no, that's not always necessary. And so there are other factors that we can look at to determine whether this is a viral infection versus a bacteria. And so what I would encourage anyone to do is be careful about the use of antibiotics. And I think that's something that we have to learn in our society as well, is what are the negative effects of using antibiotics indiscriminately. And so we already think that hormones and antibiotics may have a role in cancer development. We already believe that it has a role in autoimmune and other diseases. And so one of the things that we can do as individuals in our lifestyle changes is be very judicious about the antibiotics we use. Make sure that those antibiotics are only prescribed by a doctor. When they are prescribed, take them appropriately and completely, and you are going to limit some of the negative effects that you can have from taking antibiotics.
And you obviously distinguish Western countries, and obviously one Western country that we're fairly tied to and affectionate of is the United States. Obviously, we have a poor diet here. We have a lot of obesity. Is it fair to say that the Eastern countries have less in the way of chronic illness?
Certain illnesses, that's exactly correct. So we have noticed things like inflammatory bowel disease, and we have to be kind of clear about which populations we're talking about. And so it tends to be the populations that don't have growth hormones in their foods, that eat more of a diverse diet, things like leafy vegetables and fruits, and more lean meats that are maybe even roam more, exercise more, so have less fatty composition. It seems that other regions have less of certain things as type 2 diabetes. There may be less obesity in that society, autoimmune type conditions like inflammatory bowel disease, multiple sclerosis, food allergies, all of those things. Yes, so specific disease processes tend to have a lower incidence in other areas. And we think it's obviously multifactorial, but we do think that diet, lifestyle, all of those things influence that, and possibly antibiotics, their microbiome, all of those things.
Right.
Yeah. And so I want to talk a little bit about what the microbiome can do for us. So what is the role? So some of the things that we talk about, I have listed here. So the microbiome, or the bacteria that are just kind of hanging out in our body, it can influence a lot of the things that we do. So you can imagine a bacteria is going to be recognized by our immune system. Okay. So it might help our immune system to become more mature, to identify early on which bacteria are supposed to be here and which bacteria are not. That's called maturation. And then homeostasis means establishing balance. So early on, when you take on that bacteria, it's helping with that. And then there's signaling involved. So you can see here, it's called host cell proliferation. All that means is that the cells in your body recognize bacteria around it and says, hey, there's bacteria out here. Maybe I should form a barrier. So maybe that's your gut, that's your colon, that's host cell proliferation. Vascularization, that just means forming a blood vessel. So forming of structures that help protect you. So the bacteria, that microbiome, is influencing your body to know, hey, we should be building this. And then there's some signaling aspects of that as well. So there's a lot of studies being done now on neurologic signaling, from things like mood to stress, even things like autism, okay? Hepatic encephalopathy, we actually know a lot about. And all that means is confusion that is sometimes associated with liver disease, okay? We know that the microbiome can play a role in that. Signaling pathways for growth and health, that also is a major part of what the microbiome does. One of the things that we often overlook is that our body can't do all the processing of the nutrients that are absolutely necessary for our body. Things like folate and vitamin B12, vitamin D, steroids, certain neurotransmitters. We actually require our microbiome to help us in the production of those molecules. And so if you're doing things that take out a certain group of healthy bacteria, you may be basically preventing your body from having its necessary nutrients. So that's something that we must keep in mind. And then overall metabolism, from things like what's released from our liver called bile salts that help us digest certain foods, from branched amino acids, which is what comes from proteins, to even drugs that medications that we may take from different reasons. We know that the microbiomes helps with the metabolism of those things. So if your microbiome is thrown off for other reasons, then you may not be metabolizing some of the drugs that you take on a daily basis at a normal rate or normal level, and that may place you in danger as well. The microbiome has been contributed to many disease processes. So I mentioned allergies, food allergies, and other allergies. We know that it's something about the exposure of the microbiome to our immune system early on that helps it to identify what's good and bad. And when that is off, called dysbiosis, that we might develop more allergies and develop more autoimmune conditions. So an autoimmune condition like inflammatory bowel disease, like multiple sclerosis, like type 1 diabetes, those type immune or autoimmune processes is your body saying what should be normal, recognized as okay and safe. For some reason, because of that dysbiosis or that signaling, your body starts to identify that as foreign, and therefore it attacks it. And so that is the basis of most autoimmune processes, or what we may even think of as an allergy. An allergy is your body recognizing something that's foreign and then basically producing an immune response to it: a sneeze, a cough, a fever, hives. That's what we're seeing. And so we now know that the microbiome plays a major role in that.
Yeah, I think that really the one thing we have to get across is that you're not your microbiome is something that is not passive. You can actively participate in increasing its diversity. So whether you were born via a vaginal method or C-section, yeah, you didn't have much control over that, but there's a lot of things you can do to improve upon your microbiome. So I know you'll get into that later on.
I think that is wonderful timing, Dr. Jaguar, and I think that's very important. And I think this is probably a good time to talk about what things we can do to influence our microbiome. So I've talked about things like your diet, limiting excess sugars, fats, doing things that tend to be antioxidant or antioxidative. So things like exercise, limiting obesity, all of those things. Being careful what antibiotics you put in your body, being careful about hormones, all of those things can influence our microbiome. But then one thing that I think is very common, and I'm sure is on the front of people's minds is, well, what about this whole thing about probiotics? Well, what is probiotics and what does that mean? Well, probiotics, that's a very important component now that we better understand about the microbiome. So what are probiotics? So this is a newer field in the last 10 to 12, 15 years or so of how do we use known bacteria thought to be beneficial to help improve our microbiome. So before we start talking about probiotics itself, I do want to point out diversity in foods that you eat, vegetables, meats, lean meats, those things, being out in your environment, interacting with people, all of that can positively influence your microbiome. But then we also have probiotics. So probiotics is something you can find in a store. It is essentially a culture of bacteria. Probiotics are also very common in many of the foods that we eat. So yogurts, cheeses, fermented meats, certain juices. You may have heard of things like kombucha that's getting very popular, or kimchi, even pickles. Okay. And then there's supplements that you can get as well called probiotic supplements. You can just find it in a local health store. All of those things, the whole concept is taking known amounts of what's considered good bacteria, the bacteria that is used to colonizing a healthy GI tract, and taking those in on a regular basis to ensure that you have a healthy number of good bacteria while avoiding or reducing the percentage or number of unhealthy bacteria. And so we know, and there have now been many studies about probiotics that show that it improves the host immune response, meaning just like we mentioned from birth, that bacteria helps interact with your immune system, and that interaction helps your immune system know what's right to do and what may be wrong to do. In the same sense, the probiotics can help with that immune response. We also know that probiotics can have some effects on the bacteria, the bacteria in your gut. That composition may result in signaling things like your mood, depression, anxiety, okay? Things like hunger. So there now been more recent studies about the relationship of the microbiome and obesity. Well, we know some of that signaling done by your gut that sends signals back to the brain to tell you, hey, I'm hungry, or we should eat more. Well, we now know much of that signaling comes from the microbiome, and you might be able to create a positive signaling that would reduce obesity. The other thing is inflammation. So we know that there's certain types of bacteria, depending on its location, can be pro-inflammatory or pathogenic, meaning causing damage, where there's other bacteria that tends to be anti-inflammatory. And I think in general, we should always think about anti-inflammatory as being protective in many ways. Okay. And so one of the ways we think probiotics work is by reducing acute and chronic inflammation. And so what's interesting is that in my field, in inflammatory bowel disease, which is an autoimmune condition that attacks the GI tract, there have been many studies that show particular types of probiotics. One particular name that is getting a lot of buzz right now is VSL number 3. Well, that specifically in inflammatory bowel disease tend to reduce symptoms, have an effect on inflammation, all even inflammatory markers that we look at in the blood seems to reduce those things. So that's almost direct evidence that the microbiome and probiotics may influence the trajectory of a disease process. Metabolism I mentioned already, and then bad bacteria. So when you think of things like pathogens or bad bacteria that damage the cells of your body, we know that basically lining your GI tract with positive bacteria might prevent the colonization of bad bacteria. And so that's one of the really important things about probiotics. There's a lot of kind of an evolving field about prebiotics, meaning the food to treat probiotics, or postbiotics, or symbiotics, which means giving the food and the bacteria, the good bacteria together to create this happy environment in your gut. So we're learning a lot. And I did want to kind of comment just on how recent some of this is. So what I did is I created a graph here of the publications using PubMed. So
That's unbelievable. Yeah.
yes.
Yeah.
So PubMed is our major search engine. It is a way to record all of the research publications nationally and internationally. And so this is a graph looking at the number of publications per year, specifically on the microbiome. So if you look as recently as 20 years ago, even in 2007, 2008 or so, very little publications on the microbiome. And now you can see in recent years, we've gone from upwards of 2,000 to 2,500, more than 2,500 publications last year on the microbiome alone. So you can imagine our knowledge in the last 10 years has really increased exponentially. But it also points out that we still have a lot to learn about the microbiome. So I just wanted to use this graphing as an example. And so what are we learning about the
Dr. Eaddy,
microbiome?
before you go on, so we obviously are advocating for probiotics. One of the things about the American College of Lifestyle Medicine is they don't advocate for a lot of supplements. You're obviously not writing a prescription to go to your local pharmacy to get these. What is your recommendation when you say to a patient, I want you to take some probiotics? Do you say go to your local health food store, or do you have an actual product that you recommend?
Yeah, I think that's a great question. And so because I'm a gastroenterologist and I deal with the GI tract every day, often some of the conditions I'm seeing are things like constipation or diarrhea, or I mentioned briefly inflammatory bowel disease, or symptoms, nausea, vomiting, acid reflux, all of those sorts of things. Well, in some of those conditions, we've been able to show that probiotics helps. And so then the next question becomes, well, Dr. Eaddy, what do I do? What should I take? And the first thing I ask is, well, what do you do already? You know, do you like yogurt? Yogurt has probiotics. Do you do yogurt? Have you tried yogurt? If you like yogurt and you already eat yogurt every morning, I'm perfectly okay with that, right? And if it makes you feel better, great. But if you're looking for a supplement, I say you're exactly right. You can look on Amazon.com. You can go to your local, nutrition store and just ask, hey, what's a common probiotic? What I tell people is not to break the bank. So you will see all of this about different probiotics and the diversity in the probiotics and the specificity. The reality is we don't know a whole lot. We know major areas, things like lactobacillus, different types of uh, probiotics help the immune system. We know that if things get a little more diverse, that's helpful. And so I usually tell people, find something that's affordable, a middle of the road, that has a little more diversity. If they want me to describe specific ones, there's ones that there's been clinical trials on that I follow. That's an inflammatory bowel disease. So I mentioned BSL number 3. That's one of the ones that, our studies in inflammatory bowel disease suggest that it's very good symptomatically for inflammatory bowel disease. Florastor is another just common name of one that we tend to recommend in GI that people tend to have a good response for. But most importantly, I tell people, get some antibiotics, take some daily or as often as you see fit, and then see how your body responds.
Right.
I'm not sure if you're taking it for diarrhea, you may be taking it for constipation, you may have joint pains. Try it, see if it helps. If it doesn't help, try a different one.
Yeah.
If it does help, keep it up. It's probably doing the right thing. And so that tends to be, I try not to point my patients into one direction. I actually like to save them money. There's an anecdote that I heard while in medical school talking about Americans, and it basically said, Americans have the most expensive urine in the world. And what they were talking about is all of the vitamins that we take in. We may spend a lot of money on vitamins, but a lot of times we may be taking way more vitamins than we need. And in the same way, Americans may have the most expensive stool in the world. If we're taking very expensive probiotics that may do the same thing that yogurt or kombucha, eating just a more diverse diet does. So the first thing I encourage is taking in a very diverse diet with fruits, vegetables, grains, lean meats, those sorts of things. And so that is something that I talk to patients about.
Great. Thank you.
Yeah. And so I'm going to talk a little bit about what we're learning. So I just showed all of those publications about what's going on in the microbiome and what we're learning every day. Well, there's already been preclinical and clinical examples of the use of the gut microbiome to help with therapies. One of the most significant ones, and I'll touch on a bit later, is the use of stool transplantation for what's considered a pathogenic bacteria called C. difficile infection, or C. diff, you may hear. And so I'm going to talk more about that one later, but that is one where we directly show if you take a healthy microbiome and you give it to a person with an unhealthy microbiome, you can treat or prevent the recurrence of this pathogenic or damaging bacteria. And so that is probably one of our greatest examples of the microbiome works, okay? Other is targeting special components of the microbiome. So we know that the microbiome influences coronary artery disease or atherosclerosis, the buildup of plaque in your arteries. Well, we know that if we target certain areas of the microbiome, specifically this transmethylamine synthesis, if we can target that with certain drugs or probiotics, then maybe we can reduce the inflammation and buildup of plaque in our vessels. That signaling to the brain, we now know that anxiety and mood is influenced by certain bacteria. So there's been studies on bacteria such as B. fragilis, things that just make up our microbiome may influence certain cancers, and I'll talk about that a little bit more next. And then we even know that we can engineer certain bacteria, specifically E. coli, and it's something with the signaling of E. coli that basically can help your body in not storing too much fat. So it's that signaling in obesity that we now know we can use the microbiome. And so there's some preliminary studies looking at engineered E. coli to help do that. So all of that stuff we're just learning about, and there's plenty more. So how is all of this happening? What's going on? How does your microbiome change? And so I wanted to use these two diagrams as just an example of things that we've already talked about. So there could be bacteria, the ones that are considered pathogens or bad bacteria. So we've all heard of your stomach bug. So what is that stomach bug? So your stomach bug can be viral, it can be bacterial, but it's basically a pathogen, a viral pathogen, a bacterial pathogen. That means it causes damage to the GI tract in some way through signaling, direct damage of the lining, but all of those things, that pathogen can now do things like cause diarrhea. It can actually use up the nutrients that the good bacteria normally keeps around to grow. Well, it can essentially steal those nutrients away so that it can grow, so that the good bacteria have to stop growing, or it may cause inflammation itself. And so we do know that when those things happen, it can change the different levels of the microbiome. We know that our genetics plays a role in it. So there are certain mutations in genes that we've identified that will change the microbiome that's able to live in the gut. Okay. We know that something about those genetics might make you more prone to certain disease processes. You can see here NOD2 or IBD5. Those are already thought to play a role in inflammatory bowel disease. Autoimmune types of diseases with the ATG mutations have already been associated with major changes in the microbiome. And so what's been interesting is you take a collection of patients, let's say with type 1 diabetes, you look at their microbiome and see what things they have in common. And then now you can trace that back to certain defects in their genetic composition, or you might trace that back to certain signaling abnormalities related to their innate immunity, meaning the cells that make up and help us fight certain things. We've been able to identify certain processes that help keep us healthy, things like autophagy, which means breaking down the bad cells in our own body. We now know that those processes can be thrown off when the microbiome is off. Phagocytosis, that means engulfing of bacteria that might be bad, okay? We know that that can be altered depending on the microbiome. And so what this diagram on the right is showing is that there's this vicious cycle, and that cycle can lead to things like inflammation, okay? Inflammation might lead to ulceration or scarring. And so now, when you're thinking about the colon or small bowel itself, you might be thinking inflammatory bowel disease and ulceration. When you think of fibrosis, you might be thinking about liver disease and certain types of liver diseases like cirrhosis that we hear about. And then even taking the next step in terms of metaplasia or cancer. Metaplasia just means the changing of a cell from its normal state to one that is starting to go towards a cancer type phenotype. So we see metaplasia, dysplasia, cancer. All of that just means a cell not acting normally. So we now know this vicious cycle can go down this pathway of leading to things like inflammatory conditions and cancers. So what are the major players? There's some major players in the microbiome. We kind of touched on some of these. This diagram is to say that the microbiome is not just having an influence on the surface of your gut, that tennis court that we talked about, it's having more of an influence than that, okay? So not only is it dealing in that layer called the epithelium of your gut, but it can either send signals, or in cases of barrier breakdown in your gut, some of them exist naturally, that bacteria can cross those layers, and now it can interact in an area called your lamina propria. All that is a fancy term to mean between your epithelium and, let's say, your vessels, so the surface and your blood vessels. Okay, we also know that this bacteria can sometimes get in your bloodstream when those barriers are broken down. Okay, and these bacteria over time, especially the pathogenic ones, meaning the ones that cause damage, now have special processes that actually disrupt our natural barriers. So just like our skin is a natural barrier from the environment, our gut is a natural barrier from the environment. And we know that these bacteria can influence those barriers. And then they can do signaling, meaning signal immune cells. There's good immune cells sometimes, there's bad immune cells. Immune cells, and it depends on the condition, it depends on the situation. If you're fighting things when you don't need to fight, well, that's kind of your autoimmune condition, okay? Or if you're not fighting hard enough when we really need you to fight, well, then that's when you might get an infection, an abscess, a fever, those sorts of things. And so we do know that these bacteria interact with the different components of the immune system. It's got all these fancy names, Treg cells and dendritic cells. All that means is that many components of our immune system have different roles, okay? And so when these bacteria interact with those components, if that interaction isn't correct, now your immune system's not working properly. And now let's say your immune system creates these special names called cytokines, which basically mean signals of inflammation. Now let's say that signal of inflammation goes and hits a blood vessel cell. Well, now that blood vessel cell may be more prone to plaque buildup and cholesterol. And so now you may be talking about coronary artery disease, or let's say those same signaling cytokines. Well, we know that cytokines play a major role in much of cancer pathogenesis, or the way cancer forms. So all of these interactions, when it's not going well, may lead to things like coronary artery disease, autoimmune disease, and cancers. So those are the major players. And so when talking about cancer, we already have a lot of information about some of the roles that the microbiome play in specific cancers. And so I'm going to talk a little bit about that next. So this is, what is the role of microbiome in certain cancers? So in the lab that I studied in at Vanderbilt, one of our focuses was H. pylori. So H. pylori is very unique because it's one of basically the few known bacteria that is a direct carcinogen, okay? We know that H. pylori in the gastrointestinal tract will lead to stomach or gastric cancer over time. And what we've seen is that there's different populations that may be more likely to have H. pylori. And this and so those places specifically tend to be underserved populations, more rural countries. We see a higher prevalence, high in South America, Mexico. It's high in areas of Africa. It tends to be greatly influenced by ethnicity. So the percentage of individuals with H. pylori varies by location and ethnicity. What's even more interesting, and this was studied specifically in the lab that I was in, is if we look at people in the same region and we just look to see if they're in the mountainous region or in the valley. These studies were done in Colombia, South America. If we look at the difference between being in a valley or a mountain, just that difference alone changed the type of H. pylori and how detrimental that H. pylori could be. And we were able to show that there was a greater propensity of gastric cancer in the people that lived in one region over another region. And we were able to trace that back to the type of bacteria, the type of microbiome that grew in that area. So we know that gastric cancer is directly related to H. pylori. We also have information about colorectal cancer. So this mentions some of the bacteria. Some of them you might recognize, things like Campylobacter. That's one that can cause a diarrheal illness. But what we now know is that if there's an overgrowth of certain detrimental bacteria, well, this leads to some of that signaling, some of that cytokine production, stimulating of the immune system. So that NK cell or T cell, that's just one of the players of the immune system. Well, we now know that that interacts with certain cells in the colon. And when that interaction is unhealthy, that leads to colon cancer. Okay. And in the same way, in the liver, there's a bacteria called Clostridium that we've linked to liver cancer, fibrosis, cirrhosis, which is scarring of the liver. We know that if there's an abnormal regulation of that part of the microbiome, specifically this Clostridium type of bacteria, it leads to signaling like those cytokines, as you see up here. LPS is a special type of cytokine, the CXCL16. All of those are signaling molecules that might tell certain cells, you need to grow and you need to grow rapidly. Well, that might lead to scarring or cancer. And that same thought is in pancreatic cancer. We know that bacteria in our gut, so the small intestine is right by the pancreas. There's actually a tube that goes from the small intestine to the pancreas. It's how the pancreas releases its enzyme. Well, bacteria is able to go up that tube. We've noticed that if there's a certain type of bacteria, specifically this gamma proteobacteria, if that is going in high levels in the pancreas, well, it may increase your risk of pancreatic cancer. And even more significantly, we've been able to show that some of the chemotherapies, specifically this gemcitabine, is influenced by the microbiome, specifically this gamma proteobacteria, where that bacteria might inhibit the effects of that chemotherapy. So we're learning a lot about what role the microbiome can have in cancer. And now we have some of our scientists and researchers now looking at ways to manipulate the microbiome to try to help with cancer therapies. And so this next slide that I'll show you is just looking at, remember, that milieu or this group of immune cells. So we now know that we can use good bacteria, and good bacteria might activate the immune cells that recognize tumors and help fight tumors. So one of the very much growing fields of cancer therapy is the role of our immune system at preventing and treating cancers. So we know that a robust immune system might identify abnormal cells and cancer cells and prevent them from growing. And so what scientists are now doing are trying to promote these positive bacteria to help our immune system fight. And then we also know some of those pathogenic bacteria that we discussed, specifically one like H. pylori. We know that it has special mechanisms to suppress your immune system from identifying it. It also suppresses that immune system from pushing back abnormal tissue or cells. And in that way, it leads to cancer. So we're learning a lot about certain therapies that can be used utilizing the microbiome. Next, I'm going to talk about, well, microbiome. Does it work? What are some examples?
So Dr. Eaddy, we're about at the 5-minute warning.
Okay, very good.
You told me you could go for 2 hours, and I believe you.
There you go. Yep. So one of the things I'm going to talk about here is just one of the very special ways that we use the microbiome, and this has probably been the most convincing evidence that the microbiome really works. So there's a bacteria called C. diff. What we've noticed is that C. diff shows up more often in people that have been exposed to certain antibiotics. Okay, it tends to happen in people that are older in age. It tends to hang around hospitals where there are sick people, people with weakened immune system, or people that have had this condition before in the past. Well, we know that it's something about that aging process or being sick that disrupts the microbiome in such a way that it allows these bacteria to essentially take over. Okay. And then this bacteria called C. diff can cause tremendous diarrhea. You're in the hospital. It's not able to be controlled. You can be dehydrated, cause kidney failure. Well, this slide is to show that we can specifically take the good bacteria from a healthy individual and using that bacteria and doing what we call a fecal microbiota transplant. That is essentially taking good bacteria and directly putting it in someone's colon and allowing that bacteria to grow, and it treats that bad bacteria and keeps that bacteria from coming back. And it's actually, in what this graph is showing, it's more effective than the antibiotics that we've had to treat this. And even more significantly, it will keep that bad infection from coming back at a higher rate than than the antibiotics that we have to treat it. So that's one very clear way that we've used the microbiome. And then I have an additional slide that is just what's to come. This is clinical trials utilizing the microbiome to treat things like melanomas, solid tumors, renal cell carcinomas. Some of them are using fecal microbiota transplantation. Some of them are using kind of those signaling molecules as well. So there's more coming. We're learning more. And then just to kind of close things up, I wanted to talk a little bit about colorectal cancer. This is Colorectal Cancer Awareness Month. So colorectal cancer is the second most common cause of cancer deaths in men and women. It's the third most common cancer overall. Greater than 50,000 people die each year from colorectal cancer. But what I really want you to know for yourself and tell your family is 60% of these deaths are preventable. Okay. 1 in 20 people will be diagnosed. Only about 1/3 of individuals are up to date on some type of colon cancer screening. So what is that screening? So screening starts at age 45 or sooner if you have a family history of colon cancer or polyps. If you personally have some symptoms, certain warning signs to look out for: weight loss, blood in your stool, abdominal pain, just a change in your bowel habits, all of those things. If you are 45 or have a family history or have symptoms, talk to your doctor about, hey, doc, what should I do about colon cancer screening? Okay, so that's very important because this is a very preventable disease. And then what things can you do now? What are those lifestyle modifications? Many of them are the same things we talked about with the microbiota. Eat a healthy diet, high in fat, diverse diet, limit heavy sugars, excess sugars and fats. Try to avoid being overweight. Exercise. Exercise is anti-inflammatory. Remember, we keep coming back to that. Quit smoking. Smoking is pro-inflammatory. Alcohol use. Well, alcohol use, pro-inflammatory. So limit the amount. Don't drink in excess. So I'll kind of close on there to allow room for questions. And again, thank you for allowing me to talk.
That was unbelievable. And I appreciate the fact that, you know, it is March. We're going to talk a little bit more about colorectal cancer next month. But it is Colorectal Cancer Awareness Month. And it is a situation where most of my career, the recommendations were to start colonoscopy or secondary prevention measures screening at the age of 50. So it's obviously dropped to 45 now. But clearly, if you're having some kind of symptoms, as Dr. Eaddy described, some abdominal pain, some change in your bowel habits, some any blood in your stool, it doesn't matter how old you are. It just you have to go ahead and see your physician about that. We had a lot of activity in the chat. Obviously, one person said, "Is there anything different that you recommend as far as diet or probiotics for somebody who's had their gallbladder out?"
Yeah, the gallbladder is an interesting one, specifically if they have their gallbladder out and they're having symptoms. So things like diarrhea, okay? So it's very common after getting your gallbladder out that you have diarrhea and bloating. okay, distension, flatus like gas. So there are a couple of things that I recommend. So not specifically a type of probiotic, just a probiotic. It's also important to know that people that have their gallbladders out get what's called bile acid diarrhea or bile acid gastritis. So you might get stomach discomfort, you might have loose stool or gas, and that's because the gallbladder actually has a function. It's supposed to hold on to that bile acid and only release it when you're taking in foods that require bile acids to be digested. Well, when the liver is always producing bile acids, and so those bile acids are going to be released from the liver all the time. Well, if they're not mixed in with food, they can get to the stomach, cause irritation, gastritis, all right, and symptoms, or they can get to the colon, and in the colon hates bile acid. And so what the colon does to protect itself is release a lot of fluid, and that's diarrhea. So if you're having those symptoms after having your gallbladder taken out, things like diarrhea, bloating, and gas, ask your primary care doctor to talk with you about what the options are, or maybe even refer you to a person like me who can treat things like bile acid diarrhea and bile acid gastritis. But again, same recommendations: healthy diet, lean diet. So know that you may be less able because you're not storing up that bile acid and releasing it in big bursts from the gallbladder. Well, things high in fat may be harder for you to digest. So you might want to do smaller meals multiple times a day. The other thing that I suggest is something called a low FODMAP diet. So low FODMAP, that stands for fermentable oligo di and monosaccharides and polyols, a long word that means the bacteria in our gut like certain substances. That's the FODMAPs. And so if you focus on the foods that those bacteria, some of the bad bacteria, don't necessarily like, you may have less gas and bloating, because when certain bacteria see those foods that they like, they release methane and other gases that might cause bloating, cramping, flatulence, and even diarrhea. And so I would encourage a low FODMAP diet, very diverse diet. And then if you're having issues with diarrhea, talk to your primary care doctor about seeing a gastroenterologist about that.
So obviously we recommend a plant-based whole food diet, less in the way of processed food. There was a comment about, the fad diet, the ketogenic high protein diet. Does that in any way positively or negatively affect the microbiome?
Yeah, so we're still learning a lot about that. When talking about these ketogenic diets and things, it's really about quantity. So we do know that things like meats, especially ones high in saturated fats and other fats, they tend to be pro-inflammatory. But the whole concept behind a ketogenic diet is you're reducing your overall calorie consumption. And so the idea is that you're going to better be able to metabolize these fats and things. But I don't know that we know yet. Honestly, we haven't had enough time to see what this oxidative stress is going to do long term. So we know things like red meats and fatty meats result in oxidative stress. There's been studies in colon cancer looking at people that do a high proportion of, fattier meats versus a plant-based diet. And there are very clear differences in the number of cancers, both breast, prostate, and colon cancers, in people that tend to do more of a plant-based diet. So while yes, a ketogenic diet, because of it's essentially a restricting diet, it might reduce the number of calories you're taking in, it may not necessarily be better for your long-term health. So I would just say we don't know enough, right, because those are newer diets. And so I would just say anything you do it in moderation. And if you are not diversifying what you're eating, and you're not doing things like that have antioxidant properties, then you may be putting yourself at risk of long-term adverse effects from the oxidative stress related to meats and fats and high sugars.
So unbelievably good. We have run out of time, and I thank you for your putting this together. And obviously we'll have to have you back every couple of years, given the fact that this field is burgeoning. So I suspect in 2022, we'll have 5,000 publications. And so there'll be more and more knowledge for which you can impart. But this is all so good. And obviously not anything that we learned in medical school, but you know, you're out far enough from medical school. You didn't learn this in medical school, but it's happened all since then. But it's a major ecosystem within the body that we're just learning about. We're going to map this and find more and more about it and how it affects our health. So I appreciate your time and your efforts in putting this together. And thank you all for joining. And we will have another in the series of the Cancer Prevention and Wellness series on April 14th, and we'll talk about colon cancer and the signs and symptoms and prevention. And I'll leave you with a quote from my favorite philosopher, Winnie the Pooh, via A.A. Milne. And he says, I always get to where I'm going by walking away from where I have been. He's pretty deep, so I'm going to read this again. I always get to where I'm going by walking away from where I have been. So kind of take some of the messages that you heard tonight and take that quote and go forward and be healthy.
I love that.
Everybody.
And thanks for having me.
Yeah, thanks very much.